Do you want to lift your belly without undergoing surgery? Well, today I am doing PDO threads to lift our patient's skin. So this is a great treatment, especially if you've lost weight recently with all the GLP-1s that are on the market, or if you just have been doing a great workout and you just want to lift that skin. PDO threads can help. So I have already drawn on my patient's belly. I know you can really tell what I'm going to do, but I can, which is what's important. So these threads can be used anywhere. So belly, arms, butt, knees, inner thighs, obviously face, neck, chest. So PDO threads are made of polydioxanone. It's the same material that surgeons use in the OR. And now we have figured out how to use them in aesthetics. I'm gonna try to get as low as I can go. There we go. I need to make a channel because the PDO threads are on a cannula that does not have a needle at the end of it. So you can kind of see it's not a pokey needle right there, it's blunt. So that's why I need to make a channel, a pilot, so I can get in there. Here we go again. Cool, I'm gonna go all the way downtown. There we go. Beautiful. So these will reposition your skin, and then they will make collagen right around them. So I always call it the procedure that keeps proceeding.
Love it.
Yeah, me too. I do love these. And so as it takes 2 years for them to dissolve, the entire time that they're in there, they're making you make collagen around them. There's many different types of PDO threads out there. These are barbed threads. So they really, stick. And then afterwards, you're not gonna have, there's not really any downtime. I just don't want you exercising where you're jumping up and down, because you really need to let your body surround the threads, let your skin, connective tissue surround the threads. And if you jiggle, the threads might fall a little bit, and the whole point of these is to lift. And there's all sorts of different types of PDO threads, like I said before, but not only are there different companies that make PDO threads, but there's different types. So these are barbed. There are ones that are smooth. So you use smooth PDOs, like if you had upper lip lines or forehead lines that you just wanted to make collagen in, and that could just, like it says, smooth out those lines. Typically when you do the smaller threads, you usually need to do 2 sessions. These larger threads typically is just 1, until you're like, oh, I love it, and then we do it again. So then there's twist threads. So the twisty threads give you some volume. So for example, if you're somebody that wants more fuller lips, but you don't want to do lip filler, you can actually put the twisted threads into the lips, which will make you make collagen around the twist and therefore give you a little bit more volume. You can put them into like the nasolabial folds. That's another area where people like to have volume. You can do them around the eyebrows to help lift the eyebrows. So, of course, you can do them all over the neck or all over the jawline. I mean, really, you can put them anywhere. So smooth, twisted, barbed. These are called beyond threads. So they have barbs going in 2 different directions, so they give even more lift. A long time ago, though, there were some threads that got taken off the market. But that was in the early 2000s. These threads are nothing like those. So if you're reading like threads are bad, you might be reading about the old threads. Also, sometimes people say, well, if I put these in my face, what if I want to have plastic surgery? Well, you should really be having, if you're going to be undergoing plastic surgery, don't do threads within a year of doing that. But after a year, 2 years, like I said, after 2 years, they're going to be completely dissolved. So it shouldn't be a problem for your plastic surgeon. And if they tell you it is a problem, then go to a different plastic surgeon, because they should be able to go, hopefully if you're doing a facelift, for example, and you have PDO threads in your face, they probably should be going, and again, I'm not a plastic surgeon, so don't take my word for it, but below where I am putting the threads. So the thread, they shouldn't run into the residual of the threads. So really there's no reason to not do these. Now, if you, I guess maybe if you're somebody that has had surgery before and you've, quote, pushed out your sutures, you know, your body doesn't like sutures, well then don't do these. But you'll probably tell your provider that. So I've had people tell me that, and I just tell them, okay, we're not gonna do threads on you because I don't want you to push these out. But really that's like the only real, I mean, it's not really even a contraindication. I guess a contraindication would be is if you're running a marathon next week, then you wouldn't want to do that, but it's just timing. It's a timing issue. Okay, so they look good while she was standing up. So now we're gonna cut off the little ends so she doesn't have to walk around with these threads hanging out. Okay, and we're just gonna go straight like that. And that is all anybody's gonna see. Because there's no downtime. That's why it's secret, because there's no downtime. So unless you're walking around in a bikini tomorrow, and people probably wouldn't even know. Like, oh, hopefully they're not looking at you that closely. But if they were, they wouldn't know what those little spots were. And those will heal up in the next couple days. I'm gonna put a little arnica and let's smooth out those. Tuck these little guys in, ready? Tuck. So there you go. So after PDO threads, like I said, you don't want to be running any marathon. You don't want to be doing a lot of jiggling. And really, if you're going to do it in your belly, you'd want to not do any like really heavy core workouts, because again, the whole point of threads is to lift and reposition. So if you're jiggling or working them, you don't want them to fall. These are really strong PDO threads. I can show you one, maybe you can see those barbs are going in different directions. So they're really pulley, and this is really strong. It's an 18 gauge thread, so it's really, really tough. So you can't break, they don't break, and they're antimicrobial. But with that being said, I still don't want you jiggling. I don't want you doing things that might make them try to want to fall. And then over the course of the next 3 months, they'll make collagen right around them and lift up even more. So your belly will look better and better and better and better. What else I don't want you to do is I don't want you to go jump in a lake, because these are open little wounds right now, at least for the next couple of days, or get into a mud bath. You know, these are little medical devices that we put in there. And although they're antimicrobial, I don't need like a dog to be licking the exit wounds. And those will heal up in the next couple of days. And that's really basically it. I mean, I think if you want to use a tightening cream on your belly, that's just great. And then you just let them do their job and they will work because they are amazing. So if you want to find out more about PDO threads or about any of the procedures we do at RejuvenationMD, you can find us on Facebook, Instagram, YouTube, and on our website at RejuvenationMDmedspa.com.